welcome to Nurse Rants. I'm Debbie, a registered nurse certified in medical surgical nursing and case management. The purpose of this channel is to give you some resources for your health journey. I would like to weigh in on a lot of issues and topics that might be relevant to either yourself, your family, or your patients. I hope that this channel is informative and that you'll like and subscribe below, and feel free to ask questions. Thanks. Let's go. So, blood pressure is one of the means that we have to judge how your heart is doing. It has two numbers that configure it: diastolic, which is the bottom number, and the diastolic reading is basically when the heart is at rest and the chambers are filling up with oxygenated blood. So that is a reading that we like to see in the mid-80s or below, probably around 84 or below. If your diastolic bottom number reading is in the 90s, you are said to have borderline or stage 1 hypertension, which is high blood pressure. So we want to talk about the second number, systolic, which is the upper number, and that is when the heart is actually beating, when the pump is working and the blood is flowing. So that is the number that we like to see in the 120s or below. If the number is in the 130s, 140s, again, that is stage 1, and that is borderline hypertension. Blood pressure can be affected by different things: stress, exercise, weight gain, anxiety. When you walk into a doctor's office, the first thing that probably happens is your blood pressure goes up because you're a little bit anxious. So you need to monitor your blood pressure and journal it for 5 or 7 days consecutively to see where your blood pressure is. You should do it at the same time of the day. You should take your blood pressure sitting down. Sometimes there's changes when you're lying down. When you're standing, blood pressure can change. That's called orthostatic blood pressure changes. So when you get up in the morning, your blood pressure should be the lowest. I want to talk to you about how to monitor that. You should actually get a good cuff or have someone take it at the same time of day when you're calm, and journal it. So that's journaling of the blood pressure. So one of the things I want to talk to you about, as well as learning what your blood pressure is to maintain it the best that you can, either if you're trying to cut down on medication or right before you start medication. It's always good to see a doctor, get them to weigh in on what your other symptoms are. If you're having palpitations or headaches, blurred vision, any of that may be a blood pressure emergency. You definitely need to discuss this with your physician or your practitioner. So blood pressure can be manipulated if you are to really be vigorous in your protocol. So let's start by talking about the American Heart Association. They make great recommendations. It is a great resource. So I highly recommend that site. It will tell you all the do's and don'ts. Blood pressure needs to be maintained. So what can we do? What can we control to help remediate our blood pressure? Whether you're just wondering if you should start meds or if you're trying to get off meds, medications, ACE inhibitors, tend to have some side effects: decrease in libido. Also, they can give us some cramping in our lower extremities. So let's talk about things that we can control. Diet, big thing. The more that you decrease your weight, the less that your heart has to struggle to support extended amounts of weight. So if you can drop 10, 15 pounds, that would help your blood pressure tremendously. How do you do that? You stop by eating fried foods. You need to stop eating as many carbohydrates as you are eating. Try to limit it to maybe one very good healthy grain or 2 a day. Things like brown rice, those are really good carbs. So if you have to have the carbs and you can't avoid them altogether, then make good choices as far as healthy carbs. The other thing that you should do is keep an eye on your caffeine. The recent studies, there's a bunch of them talking about tea and coffee, and that if you have 3 or 4 cups of tea or coffee a day, that will raise your blood pressure by 4 points. So What do you use instead? Recommendation is hibiscus tea. A lot of information out there about hibiscus tea not having caffeine and also being like a natural ACE inhibitor. I'm not saying stop your meds and drink hibiscus tea. I'm saying that if you haven't started and you are borderline and that you want to try to decrease your meds, maybe hibiscus tea is a good place to start replacing some of your caffeinated drinks. The other thing that you should really keep an eye on is salt. Salt raises your blood pressure. You need to be aware that salt is in everything. Fast food, cut out that fast food. It's also in canned goods. Also, big component is ketchup that has salt in it. Salad dressings, a lot of the canned soups. Really need to read your labels and decrease your salt. Throw away your salt shaker. That's a good start. One more thing that you can actively do, a lot of new information is coming out about pomegranate juice. Not the stuff with sugar, not pre-sweetened, pure 100% pomegranate juice. The literature says about 3 to 4 ounces every day will really lower your blood pressure. So those are some things that you can do to start getting a hold of your blood pressure. The journaling, the exercising, the watching the diet, things like hibiscus tea and pomegranate. Really research and start to look at what life changes you can do to make yourself a healthier you. One final thought in the topic of blood pressure. Blood pressure is something that will change from minute to minute, activity to activity. Recent studies have shown people who take time and watch a crackling fire or listen to a half hour's worth of music or just sit in a relaxed position and watch a fish tank consistently have lower numbers than those who don't. So although it's tough to do, really identify what stresses you out and leave some time just to do some mindless relaxation. I hope my ideas help. Please like and subscribe, and I'll see you on the next topic. That's it for now. That's all I have to say. Thanks for watching. The opinions here on this channel and the comments are solely the views of a registered nurse professional with 30 years of practice experience that is certified in medical surgical nursing and case management. The views here are not necessarily shared by employers or other nurse professional groups. Thank you. See you next time. Hope to join you on your wellness journey.